video from the CTAD clinic. My name's Dr. Mike Lloyd and I'm the clinic director. And today we're going to be looking at addressing one of the difficulties that people have about communicating with alters. So this video is particularly relevant for people with other specified dissociative disorder and dissociative identity disorder, OSDD and DID. One of the difficulties that people have is that they try and communicate with alters and it doesn't happen. So there's lots of reasons why this could happen, and we've looked at some of these already in a previous video. But I wanted to kind of have a little bit look about what might be going wrong in the process of communication when someone's trying to communicate and nothing is happening, so they don't get a reply. Firstly, any attempt at doing this is always best recommended within a therapeutic setting with a therapist who's well skilled and experienced in working with dissociation of this nature. Obviously, these can be done as sort of self-help techniques and ways of being able to try and help a person navigate through the problems and challenges of having dissociation and having alters or others within their world, within their system. But the ideal is that it's done within therapy. If there isn't therapy available to people, all I can suggest really is that to exercise great care, caution, and to make sure that there's a good stability within the world, within your world, so that if you do get anxious or distressed, that you've got some very, very good and solid techniques for being able to manage that so it doesn't become overly distressing. And one of the reasons for this is that sometimes when people do communicate with alters, they actually get a reply, and sometimes that reply can be unpleasant, or sometimes it can just be a shock to get. And the person's like, well, I can't deny it anymore because there's the reply, here's the thing. And that can be distressing in itself. And just to make sure that there's a lot of self-care going on with any application of these techniques. The same is also true within therapy, but at least there's a therapist to help guide that process. The principle of all of this communication and this foundation building of communication is that it's not trauma based. So what we're not doing or not advocating is to go and try and find the trauma in the person's background behind the dissociation. We're simply looking at the surface level of the dissociation to try and get a sense of how to begin communicating as a foundation for developing trauma work much later on down the line in phase 2 of the treatment model. Obviously, all of this work is best done when there's calm, when there's time without interruption. It can be relatively peaceful. So it's important to be able to try and find that space. And that's not always an easy thing to do. So just try and make sure that this is done, like say at home in a calm environment rather than out and about in town or on a bus or on a train or in a busy place. Now, one of the reasons why it doesn't work sometimes is the person does all the right things, they say the right things, they follow the strategy, they follow the techniques for sort of reaching out and doing that conversation. Hello, I would like to speak with you. My name is Mike and I want to get to know you. It's a relatively easy enough introduction, but it doesn't work. Now, one of the things of this is that not everybody wants it to work. So people will say, yeah, I'm doing this, and they're given it as a homework task and they run through it, but it doesn't actually turn into anything. So the person puts the technique into effect, they say the right things, and it just disappears off and it goes absolutely nowhere. And they're left going, well, I wonder why it doesn't work. Now, what we look at then is the intent behind the statement. So the question that we would ask someone is, do you truly want it to work? Because actually, when it comes down to it, a lot of people say they don't. They don't really want it to work because they know that if it does work, it means that the dissociation they've got, the OSDD or the DID, is real, it's true, and that means there's going to be a lot of work coming up to be able to deal with this. And people are often stuck in denial and avoidance of that, and they don't really want the communication to work because they know that means it's real. And they know that that means there's a lot of work to be doing. Because if you do start communicating with an alter, you've got to stay communicating, and you might not like that alter, you might not like what's being said, but you've got to go with it and you've got to stick with it. And sometimes we say yes to things when we mean no. So for example, we say we want to do something like communicate with alters, but actually when it comes down to it, is what we're saying is we don't really want to do that. And this is very different from, say, a job interview. For example, you go into a job interview for a job that you really want, and the interviewer says to you, there's an awful lot of photocopying within this job. Are you happy with that? You're going to say, well, yes, of course. Industrial level photocopying is the thing that I'm best known for. Of course, I'm okay with that, because you just want the job. You worry about dealing with the photocopying later on, and you try and get out of it as best as you can do, because that doesn't sound like much fun. And the interviewer doesn't necessarily know whether you mean it or whether you don't. They have to take you on face value. The difference between the dissociation, the layers within a person's system, is that if you're saying that you do want to do it and the truth is that you don't, the internal parts, the alters, the system is going to know that. They are going to tell that you don't mean it. And this is all about trust. This isn't about communicating with a neighbor or someone who's just moved into your street. This is about the trusting relationship from the internal parts, about holding the nature of your being, your identity, your trauma, your history, all of those things. So if you're saying that you want to communicate, but really you don't, what they're going to pick up on is you don't want to do it. So if you don't want to communicate, why on earth should we? And what you'll probably get is a blank or a rejection, a pushback of some form or another. And it won't be particularly nice. Or it's just a complete absence, a vacancy. So what I'm suggesting within this video is a very simple question to yourself is, do I really want to do this? Because if you really don't, I'd ask you to try and undo that before you started. So it's better to wait and to really start this process when you do mean that you want to do it, when you're absolutely committed to doing it, rather than sort of do it halfway. I kind of want to do it and I kind of don't, so I'll give it a go and see what happens. And you might still get a result from that, but I think it's better to approach this when you are absolutely ready, that you can head towards this communication. You do it properly, you do it sincerely, it's genuine, it's meant, and you're definitely trying to do this, reaching out to try and begin this communication process. So that's all I wanted to talk about today. We're going to look at some other videos coming up, so please do like and subscribe for the content on this, where we're going to start looking at different techniques, different ways of being able to address this communication with alters, what it might mean, what it might cause, and some of the ways of being able to handle that and deal with that. So I hope you found this video interesting. It may be that you're already there and this is kind of a nice refresher for you, or it may be that this is going to help you towards your goal of being able to achieve that communication. So look out for future content, and we'll be putting more videos out as soon as we can. So in the meantime, please do take great care.